Please, a big hand for Representative Isaac and Senator Campbell. Generous to have you both here. Since I'm on the campus at Texas State with you two, I feel like I should begin with water. That's one of the big brands for this university. They're experts in water and water research, water policy through the Meadows Center. We just had a consequential event on Election Day, the passage of Proposition 6, overwhelmingly. It wasn't as close as I thought it might be. In fact, it passed overwhelmingly, and so we have the beginnings of a plan to fund our water needs over the next series of decades. Senator Campbell, should we be sad or glad that Proposition 6 passed, and what happens now?
We should be glad. For the past 20 years, we've had a state water plan that has not been funded. With passing of the budget, there still wasn't money appropriated for water.
Right.
With persistent drought, people moving in, population scheduled to, or on track to double by 2040, we have to have water. And this, while, you know, the actual water needs, the cost is roughly about $50 billion. This only gives us a start at $2 billion. However, it will serve as an evergreen loan program, if you will, to jumpstart programs so that they can put in water projects. And 10% will go to rural areas. You know, those cities, they don't have the money to do it on their own, so 10% of loans have to go to rural areas, and 20% have to make sure that those dollars go into conservation. So it's a great plan, and it's a loan, and once a project is bonded, that loan money comes back. So while it is not enough, we've at least started not only a conversation, but at least started a plan for water.
Right, Representative, the Senator makes a couple of really good points in terms of the need for such a plan to be funded and implemented. Population is growing fast. As she said, we're going to double here in not terribly long in population. We're adding, at least the governor has been saying, and others have said, that we're adding 1,000 people a day to Texas. They're not bringing any water with them. We have come out of the worst one-year drought in the history of the state. I think we're actually back above 90% drought conditions in the state. So the demand is there. But the $2 billion that the senator refers to is, you'll forgive the expression, a drop in the bucket compared to what it is that the fullness of the plan requires, $53 billion by some estimates. So are we doing enough?
We really are, because the $2 billion will be loaned out to local municipalities to help buy down the interest rates. So that will affect all of us, and that getting the needed water infrastructure to where we need it, moving the water to where we need it, will actually cost less because we're using this money. So as this is used to buy down the interest rates and loaned out to the local municipalities, they will pay that back, and this $2 billion will in turn turn into about $27 billion over the course of the plan.
I guess the question, though, Representative, is this a sustainable funding mechanism for such an important infrastructure need in the state? There are some who believe that the legislature, rather than creating this fund out of the rainy day fund, a loan fund, that you all should have cut the budget adequately to find that money out of general revenue, or even maybe more money than the $2 billion out of
Well, I don't think it would have been a cut to the budget. We should have used the money from the budget, from our.
That's what I mean. In other words, decide to spend $2 billion or more less on other things. Find that money in the general revenue. That's been a topic of discussion.
Correct, yes, and I had some of my constituents appropriately point out that I supported the constitutional amendment, but I voted against, or I supported the enabling legislation, but I voted against the constitutional amendment because I felt like we should have taken this money and funded our priorities in our budget. We had water, transportation, education were our three priorities going into the session. We funded one of those out of available funds in the budget.
Is there anything specific, and I'm going to ask the same thing of you, Senator Campbell, Representative, that you would have cut out of the budget as it passed? $2 billion come out of one or more programs and replace it with funding for water?
Not specifically, no. It's because I don't serve on the Appropriations Committee. But had I, or will I in the future, that's yet to be seen. But if I do, I'm certain that we could have done a better job budgeting our priorities. We spend 35.7% of our entire budget on education and 35.6% of our entire budget on health and human services. 10% on transportation. We need to do a better job on our priorities.
Right. Senator, you were famously no fan of the budget.
Right.
One of four votes in the Senate against the state budget. So what would you have done differently if you would have preferred to have that money come out of general revenue?
Well, I would, and even out of general revenue, you know, I'm not sure that there's enough for all the water needs. But again, there's nothing specific, and not being able to sit on the finance committee where they
Yes.
have subcommittees and they go into the details of everywhere where appropriations are given, then you can't, it's hard to say, well, let's cut here. I do believe it would be, cutting specific things within the budget. I think it's a little reckless to say let's cut everything across the board, a certain percentage.
Right.
I think it needs to be targeted cuts. When Jason had said, there wasn't a prioritization of spending, I believe that, when someone comes to the office and they're so passionate about their issue and they need money for this and money for that, it's very difficult to, say no, if you will, but we have to do a good job of what are our wants and what are our needs. And of our needs, we need to prioritize them. And that's what needs to be done.
Well, Representative Isaac just alluded to the percentage of the budget that goes to transportation, and if the estimates are that the water problem is a 50-year, $53 billion problem, more or less, there are some people who will say that transportation may be as much as a $400 billion problem over a much shorter time frame to maintain the current roads we have in the state at the current level of congestion, but given the growth of the population, those two last conditions seem ridiculous. So are we not doing enough on transportation? We're fixing to do the same kind of a deal next year on the ballot that we did this year for water.
And what he's talking about with we're going to be doing the same thing next year is, and I am excited about it because it truly is the biggest boost to transportation funding we've done in over a decade. But that will give us $2 billion per biennium, roughly $1.2 billion or so per year for roads. But the real story is that it takes we are $4 billion behind every year just in maintenance and operation of our roads. We're not even talking about increasing capacity with that.
Right.
So what we're going to do with taking money before it reaches the rainy day fund, still put money into the rainy day fund, the economic stabilization fund, but half of that, once it's on its way to the rainy day fund, will go into transportation with a flexible floor, looking at what we need to make sure we keep for crisis, if you will, but those dollars will go for roads. Still doesn't get us where we need to go.
Right.
So do we still need to prioritize and find more funding for roads? Yes. But at least this $2 billion will be without increasing your taxes, and those dollars cannot go to toll roads.
Right. But is it enough, I guess, Senator
No.
Campbell? And should that, and again, this is a case where you've got a state budget that is, conservatives, as you two self-describe, as conservatives say that the budget has grown too much, that spending is too high. We certainly had more money this session than in previous sessions in recent memory, and yet you all still couldn't find that money out of the general revenue budget. You had to go into the rainy day fund.
And I think I'll let Jason, if he wants to comment now, and then, but there are things in the budget, I think, that we need to look at to try to get revenue sources.
That probably deals with some of our frustration and why we
Yeah.
didn't support the budget. And I think I was part of a group of the largest group of Republicans in the House that had voted against a budget in history, as far as I can tell.
Right.
To have that kind of contingent, it was because we didn't fund our priorities in our budget. And I will support this amendment next November, 2014, because we'll take half of the severance tax that's now going into economic stabilization from the gas severance tax. That'll go into roads. So now we have the oil energy putting more into the roads, which I think is great. And as we see our energy sector and our climate continue to grow, that economic development opportunities that we have,
More
will
money's gonna
continue
come
see
back to the
more
state.
and more money putting into the roads. And I was asked at a Austin Chamber event months ago, a transportation forum, and they said, what can we do to help get more money into roads? And I said, go out and buy natural gas vehicles, because that's Texas fuel. Our gas and severance taxes would increase, and you'd be putting more money into the roads, and you'd be creating more jobs here in the state of Texas. It's domestic, it's cleaner, it helps our air quality, and it's cheaper.
But to Senator Campbell's point, the amount that we need annually to maintain our roads is $4 billion. We're only allocating a little bit more than $1 billion each of these next 2 years. The problem over time is a much larger problem numerically than the water problem. So is it enough?
No, it's not. And it's going to cost us more because we're just kicking the can down a broken road, if you will. And that's why, we tried to find I was on the transportation committee, we tried to find new ways to fund transportation. One, using the motor vehicle sales tax. That was going to take so much out of general revenue, a chunk, 3-point-something billion per year.
Right.
That was a no-go.
You were going to have to find that somewhere else.
Exactly.
Right.
And then I filed a bill, Senator Nichols did, and I filed a similar bill. Okay, let's take the change, the added motor vehicle sales tax. Let's use that just for roads.
Right.
That didn't get out of the starting gate.
Right.
And then I filed a bill in special session that went through every diversion that comes off of Fund 6, and Fund 6 is where the gas tax goes to collect money for our transportation, to get rid of all those diversions. And that didn't get addressed. And the reason is because there's a lack of prioritization within the budget. So those dollars that would make sense to go to transportation are right now being put toward wants and needs. And it's going to take some shaving off and carving,
Right.
using that surgeon's scalpel, if you will, to take those dollars back, to be able to then put dollars toward transportation. And for me right now, it's roads and bridges.
Right.
We are sitting in a moving parking lot, and we've got to do something about it.
Senator,
That's
you mentioned
priority.
a couple of things that you filed during the session, ways to get at revenue, not successful, but you tried. Other things were proposed during the session. We had the spectacle of Republicans proposing fee increases or even tax increases, specifically on the question of transportation. The most notable of these was Senator Williams, now former Senator Tommy Williams, was chair of the Finance Committee, who proposed raising the registration fee for cars. If you look at, TxDOT will provide to anybody who asks a list of the burden that individual Texans endure in terms of car-related fees. We're 44th out of 50 in the country. We have a relatively low burden relative to other states. He was proposing some kind of a modest increase in the car registration fee, which over time would have put several $billions toward transportation. That went nowhere.
And Evan, I was actually at one of these events
Yeah.
in Austin at the Austin Club when
Right.
Senator Williams proposed that. And
Yeah.
I'm sitting back there in the back and trying as hard as I can to bite my tongue and not yell out, we shouldn't be trying to get to the middle, because he was saying we need to get to the middle of registration fees and increase
Right.
registration fees. And I'm thinking, no, we need to get to the bottom. We need to be at 50th.
Right.
We need to be the state where it's the easiest to own a vehicle, decrease as many burdens as possible so that more people are buying cars. We need to do the same thing on property taxes for homes so that more people can buy homes and realize that American dream, because the sales tax generated on a vehicle at 6.5% to the state contributes more than a measly increase in registration fees. And then when it was proposed in the House and never even took a vote, my understanding was there was only 55
There were no
people that
votes for it.
supported
Right.
an 80% increase in registration fees. And there are people that at the time were trying to go out and find ways to bring in more money, but burden the people that we work for.
Right.
And we weren't going to have that. And to get 55 people that were supporting it on the House floor is clearly not enough to get it to pass.
Right.
We need to not burden the taxpayers, we need to burden the budget riders. And by dedicating the sales tax from the collection of vehicles that use the roads, dedicating that to the roads, does exactly that. Then you dedicate those funds, they can't go anywhere else. You take emotion out of the budget and money is going where it needs to be
But the
going.
theory with diversions, Representative and Senator, is it sounds great, and it makes sense that if money is intended for one purpose, it ought to go to that purpose. But the purpose that it's going to instead now suddenly has a hole created. So when the governor talked in the State of the State address about taking money that was intended to go to transportation and was going to fund DPS, I believe.
Mm-hmm.
Well, he said, let's take that money away from DPS, let's put it back where it was intended, but then you create a hole where DPS funding now no longer exists. You're not going to defund DPS. It's a pig and a snake. Comes down over here, comes up over here. You're going to have to find the money from someplace else. So,
And we showed up with $8 billion extra at the beginning
That
of
we
the
hadn't-
session
that we didn't know that
that
we
we didn't
did not know
plan
we had,
on.
right.
And here's $8 billion. And what do? We increased spending from the previous budget,
Right.
and we When you look at the budget that was passed in 2011 to the budget that was passed in 2013, is a 26% increase in expenditures.
Well, you know that's a controversial
That is,
statistic.
and that's why I added some
Your
factual
speaker
information.
questions whether that's true.
The budget that was passed at the
Yeah.
end of 2011
Yeah.
compared to the budget that was passed at the end of 2013,
Yeah.
there's a 26%.
And yet you
increase.
couldn't find
But we
additional money.
backfilled and we did some accounting gimmicks that were not good.
Let me ask the broad question, Senator, on this question of revenue, because it gets to the competing worldviews at the Capitol. There's a worldview that I'm going to just assert, I believe you and Representative Isaac subscribe to, which is we don't have a revenue problem in the state, we have a spending problem. That's a correct articulation of your view. But the alternate view is we don't have a spending problem, we have a failure to invest in the future of Texas problem. The public ed community, the higher ed community, many communities that are seeing enormous growth in their expenses by virtue of this growth in population that you alluded to, Senator, are saying, look, we can't do as much as we need to. We love the fact that all these people are moving to Texas, but they're not bringing water, as I said. They're not bringing asphalt. They're not bringing public or higher education. They're not bringing
But they
health
are
care.
in the form of their tax dollars.
But if the burden on them is so low, are we really paying for the growth? Are we adequately funding the needs of the state given the fast growth? Or do we have to think about some way to sufficiently support the services that these good folks are going to require, Senator? What do we do about that?
That is an argument that, we hear. But once again, when someone comes to you with those needs, this is important, we've got to have this, we've got to have that.
Right.
What you don't hear or see much proof of is that whoever's coming to you for a need, showing how some have come to you with, look, we were successful here in cutting, we're being more efficient with spending. But overall, we have to find efficiencies. And until we do, I think that, we're going to be faced with a deficit with more people coming in, social needs going up, not enough money, and the easy answer is, well, let's just find new revenue. But that's not the right answer. That's not a business model. The Texas model, a fiscal responsibility and limited government works in Texas. And we can't deviate from that. We have to keep our eye on that.
Yep.
So, no, they're not coming in with means. Social programs are going up. We have to find a way to curb the spending before we really start looking for increased revenue
In revenue. Now, Senator Campbell, you were not in the legislature in the 82nd session. Representative Isaac, that was your first session. So you were not here when public education was cut by, again, depending upon how you calculate the number, $4 billion or $5.4 billion, whether your view of the world is half full, I guess, or half empty.
Or increase $152 million.
Or increase, right. You all went back and put $3.5 billion roughly into public education this session. Representative, was that an admission that you all cut too much in the last session?
Well, we did a deferral, and we funded that deferral.
Right.
But I'll tell you, and I'm not going to get into the finance, because there are some people that say there's just not enough money. We couldn't put enough money into education and meet our goals. I don't think there's a ceiling on the amount of money that you can put in education, or the amount of people that people would want in education. But I'll tell you what I did do this session is I filed an extremely comprehensive education reform bill that was optional for local school districts. It's an 84-page bill, and people are like, why are you filing this huge bill? It's 84 pages, replaces over 1,100. It's the most comprehensive education reform bill that I'm aware of that's been filed, at least since I've been there anyways.
Yeah.
But what it is my goal was to put the independent back in independent school district. We have got to let these districts manage themselves. If you go to the Texas Association of School Boards, there's a 34-page booklet with over 200 mandates from the state telling schools how they have to run themselves, from what type of exterminators they have to use and how they have to be licensed. And that's not the way to run things from Austin. It's more difficult for people in El Paso or Amarillo or anywhere outside of the Austin, Central Texas area to affect change because it can't be done at the local level because of all the mandates the state has put down on these local districts. It would be a huge savings for these school districts. Then they could put more money where they need to in education. And I'm going to push this. I've asked for interim charges.
So the idea
on
here is that one of the reasons that the school districts around the state don't have enough money is because they're being forced to pay to meet mandates from the state.
Yes.
Now, of course, one response to that might be, Representative, that it is everybody's tax dollars contributing to the funding of public education that flows from the state to these school districts. Shouldn't there be accountability measures of some sort that accompany those dollars back to those districts in the form of things that the state says the districts have to do, strings attached?
And I believe the federal requirements more than meet the needs. With a No Child Left Behind, with standardized testing is costing schools way too much money. The bill that I passed would allow school districts to opt into this basic self-governance, this independent school district legislation where they determine what standardized testing they want to use. Maybe it's Stanford. Maybe it had to be a nationally normed standardized test.
But
Again, it's
not
completely
determined
optional.
by the state.
Not determined by the state, determined by the school district.
Are you one of those who has said, I've heard some people say that we ought to just eliminate the TEA, that maybe we don't need a Texas Education Agency if we're going to indeed put independent back in the ISD? What do you think about that?
This sort of did that, and it didn't necessarily eliminate the TEA because they had to go in there and they had to approve the goals of the local school district. But I don't understand why we have a TEA. I don't understand why we have an SBOE. We have independent school districts. And it's easier for those of us that have children in public schools to reach out to the school board administrators and the school board officials and the administrators to make change at our local level rather than having to go into Austin to effect real change in our education.
Senator, do you share Representative Isaac's view that maybe we don't need a TEA, maybe we don't need an SBOE, we should just return control of public ed to the districts?
I do agree in giving more local control, a bottom-up process,
Yes.
and decreasing mandates. And I have not thought about whether we need to get rid of the TEA or the SBOE. You know, I think somebody does need to be responsible for looking at our Texas Essential Knowledge skills. So, and I sure don't have time to look at them. I mean, somebody does need to do that. But I think, you know, he's coming from, there's so much bureaucracy
Right.
that many times hands are tied, the dollars are hiked up that the schools have to spend. And for instance, our charter schools, we increase the number of charter schools. There's less bureaucracy on charter schools. The children do great. Well, why don't we take some of the models that are working and apply it, allow our independent school districts to use those models? And I think that in any business model, the less government is in it, the better.
In Spring Branch, you have charter schools that are being run within the school district schools, where you
Right.
have a certain number of students that are going to charter classes, to classes that are run by a charter school.
Right.
And they're same students that live in the same neighborhoods, that go to the same schools.
Right. The
are, in fact,
superintendent of Spring
going-
Branch, Duncan Klusman,
Yes.
you know, very famous for his willingness to work with many of the high-performing charters.
Yes.
So
a
you'd
big
like to
support-
see that model
big-
replicated.
Big supporter of the House Bill 300 that I filed this session. I've
replicate
asked
that.
for interim charges, and hopefully we'll
Elsewhere.
get some headway in that.
Dr. Campbell, you believe that the funding of public education in the state, Governor, I think, said at the beginning of the year, the word he used was phenomenal, that we have phenomenally funded public education for the last 10 years. You agree with that we've adequately done this, or phenomenally funded
You know,
public ed?
Let's measure phenomenal by the chunk that it takes out of our budget, if you will. If you're looking
You
just
think
out
it
of-
was a volume number, not a quality? When he said phenomenal,
do.
he meant phenomenal in volume, not in quality.
Well, I mean, I can't say for sure what he feels, but
Yeah.
when you're asking me that question, the first thing that comes to mind is the percentage of the budget that it takes. If you look at, I mean, he was quoting, 35% or so, 37%. If you look just out of general revenue, the chunk that it takes out of general revenue for educational funding is almost 40%. And then of healthcare dollars, again, it rivals education,
Right.
almost 40%. We're talking out of general revenue. That leaves roughly 22%
For everything
to fund
else, right.
everything else. So when you look at that, it's a phenomenal amount of money that's put in. I don't agree with having some of these palatial stadiums in the high schools. Allen, Texas, I believe a $90 million facility. Something is wrong
It's a
there.
good-looking stadium.
Well, it might be good looking. It may be good looking. But those are dollars that need to be in a classroom following a child. With those kind of dollars, we do not need to have the teachers having to pay out of their own pocket for supplies for their kids. Teachers are the best ones to tell us how we need to rework this model.
This is an issue you care a lot about.
Well, Well, it is, because you know why, too?
Yeah.
If you're going to look at any issue across the state that's really going to make a difference for Texas,
Right.
it's the education of our children. That's where our workforce is going to come from. It's the civil rights issue of the day. When you really look at those who are going to be in our place as leaders in the future, it's our children. And if we shortchange them, we shortchange Texas. So we have got to rework the model. I don't think there's any legislator that wouldn't fund for a good education for children. But when we are just throwing money into a monopoly, and we are not looking at an educational opportunity for a child to bring them out of a trapped or a failed school, who are we failing? We're failing a child. And you hear a lot about fix our schools, fix our schools. What about fixing the education for our children? So yes, I am. I've got a child, well, I've got 4, but I've got one in public school right now. But I chose the opportunity, and we drive 40 minutes every day to put her in a Spanish immersion class. So I have choice because I'm mobile enough
Right.
to get her there. But what about those children who may be trapped, or maybe the parent wants their child to have a foreign language? Well, shouldn't they get a choice? Shouldn't the family, the parent of the child, have that opportunity? When we fail educating our children, we fail the state, we fail the families, and we're failing our obligation as legislators.
There's going to be an opening in the Senate Public Education Chairmanship, Senator. I must say, you sound like somebody who might be interested in that job.
You know, I'm interested in doing anything we can to educate our children.
Let me ask about health care. We have a little bit more time, and then I want to be sure we bring the audience in. You were, of course, a doctor, and you talked about the rising health care costs in the state. They used to be lower as a percentage of the budget than public education. They've risen to meet public ed, and they're fixing to raise past it, actually, if we don't get health care costs under control. We are a state that likes to be first in everything. I'm not sure we want to be first in the number of citizens who are uninsured. We have 25% of our population without insurance. That doesn't count people who are underinsured or underserved. During this session, the state leaders of the state, the governor and the legislature, resoundingly said we don't want to expand Medicare, don't want to embrace Medicaid, don't want to embrace the Affordable Care Act, which after the last couple of months of the website, okay, really? Right, fine. But the general point that we need to try to do something to solve our problem of healthcare costs and the number of uninsured folks in the state persists. Coming out of the session, the legislature didn't do anything to solve the problem in an affirmative way. In other words, we know what you don't like, but I think many of us wonder what you do like. What is the solution if that's not it? Dr. Campbell, tell us.
I'll tell you, when you're looking at cost, and the Affordable Health Care Act was put out there based on access, quality, and cost. When you're talking just of Medicaid, the cost has risen so much since its inception, 1965. It's just a pig that never gets satisfied. Let me tell you, yes, we did not expand the role for Medicaid. Well, we did not increase the poverty level, if you will. But with 1,100 to 1,400 people coming here per day, I can tell you they aren't coming here with means, and there will be expansion of our Medicaid rolls. With the proposal that the expansion where the federal government's going to pay 100% for 3 years, and let me pause right there. How many of us really believe that the federal government, who prints the money, is really going to be able to afford covering the United States with growth of expansion of Medicaid? I mean, really, first of all, do we believe that? But now let's get back to, can Texas afford their part? Over the next 10 years, Medicaid growth was going to cost us anywhere between 15 and 18 billion. So we're not talking about cutting the cost of the healthcare dollars. We're talking about that growing, and it's going to grow at the expense of essential government function.
Right, but in the absence, Dr. Campbell, of taking the money from the government, whether it's 100% for 3 years, 90% for some years after, basically you're saying, okay, we're going to fix the problem with the resources we have without the help of the federal government. Tell me how we're going to do that and where's the money going to come from?
Well, one thing we've asked for, and prior to me getting there, but again, we need a block grant for the dollars that we send up. We need to be able to have the Medicaid dollars, the health care dollars we spend, we need it just block granted, meaning we have no strings attached so that we can work a solution, if you will. Right now, in the state, we basically just have fees for service that we can manipulate, if you will. But we don't have any way out there to help get sweat equity, if you will, in the game. Somebody can just go to an emergency room. There's really not incentive enough for them to make a choice to go to a clinic. Doctors have to triple book sometimes because if there's a Medicaid patient that is on the books, they may not show up. Well, they need to be accountable for that, but we have no way, because we don't have block grants, to make them accountable.
You think there's a real chance the federal government's going to say, okay, we give up, we're going to give you the money just as a cartoon bag of money with a dollar sign on it, no strings attached?
No.
Not going to happen.
No, I don't think that's going to happen. But we need some sweat equity. We need flexibility with the dollars that we can use.
Right.
And, you know, with about 7 out of 10 doctors limiting their patients that have Medicaid, there is not going to be the supply of physicians to take care of Medicaid expansion. It's going to overwhelm the system. And, you know, we're seeing people right now, they go to the emergency room, and that's where the fallout is.
Representative, the system being overwhelmed is a problem that some in Hayes County and some of the other counties you represent would say is already happening. The uncompensated care costs that are being borne in the absence of some kind of an expansion or some kind of health care reform are going up, and everybody in this room and everybody outside this room is paying a share of that.
That's right. We
So
are.
what do you do about the uncompensated care costs?
You have to get the government out of health insurance.
So would that also include Medicare?
The more the government's gotten involved, the more the costs have gone up.
So let me be clear on that. Are you opposed to government involvement in Medicare? Not Medicaid, Medicare.
We need a free market system. And I think what we've seen over the last couple of months is people are starting to realize that, gosh, maybe the government providing our health care isn't such a good idea after all. Maybe that we need competition between the states. Maybe we need to proliferate and encourage health savings accounts. I have family members who tried to get health insurance for their 3 children, and because the federal government decided to get involved in health care a couple of years ago, they couldn't get health insurance for their children. They only wanted it for their children. And I had just gone through and gotten my health insurance license, and I was helping them through the process.
Right.
And I said, you can't. You have to have one of the adults on there. And they're like, we don't want. We can't afford that. They had money budgeted to pay for health insurance for their 3 children, and they ultimately could not get it because they had to add one of the adults to the plan, and that priced it out for them. So now they're uninsured.
So again, I'm just making sure you're clear. Medicare, which is a program that has been in existence for more than just the last couple of years, covers an awful lot of people who don't have access to health care given age or whatever. You want government out of Medicare also?
I'm not going to make a definitive statement about whether we need to get in or out of Medicare. That's a federal issue. With Senator Campbell's support, we should get a block grant, and we should be able to determine how we spend our tax dollars, because it's tax dollars that you and I are sending to the federal government. They're sending it back here for Medicaid. It would be nice if we could manage the programs ourselves, just like independent school districts have state mandates and federal mandates. We have mandates on our health care spending from the federal government. And we need to get rid of that. We need to exercise our 10th Amendment rights and be an independent state of this great union and spend our money how we see fit. And that's what we need to do. And you will see costs decrease. You'll see more people getting served. But what we're going to see over the next course of the year is you're going to see 100 million people in this country that lose their insurance. 100 million. We had 15% of the population that wasn't covered. Now you're going to see that balloon to 1/3 of the population without insurance because the federal government decided to get involved in our health care.
Before we open it up, Natalia, to the audience, let me ask you a quick question about the 2014 elections and politics. At the federal level, we hear that the party that you both belong to, the Republican Party, is in sort of a civil war mode with moderates like Chris Christie, it is said. I think only Chris Christie in Texas would look nothing like you guys in terms of his conservative values that he proclaims loudly up there. You have people like Chris Christie at one end of the spectrum. You've got people like Ted Cruz maybe as a fair other end of the spectrum. So the party is kind of debating what does it mean to be a Republican, what does it mean to be a conservative these days. Do we have that problem in Texas? Is the Republican Party in any way at war with itself? I know there are a bunch of races in the House, at least, Representative, where you've got challengers to incumbents saying those folks are not adequately conservative. But as I look at the 2014 races, I look at the 4 candidates for lieutenant governor, I look at the 3 candidates for attorney general. They're all working real hard to get to the right of one another. There doesn't seem to be very much difference. It's basically about who can be the most conservative. So I wonder if you would reflect on the elections that we have coming up in the state of the party, Senator Campbell, in Texas.
You know, I think, I am conservative. There are, which is probably an understatement, but, you know, the feeling across the nation is that there is a schism in the party. There definitely is, you know, a spectrum, and what defines conservative in New Jersey is different than conservative politics here in Texas. But when you really get to the platform of the Republican Party, there are more people in the state of Texas, and I believe across the nation, that have the same values. I believe it's a value-driven party, and that's why it's labeled conservative. I believe when you ask anybody that works, you know, if they want to give a chunk of what they get when they work to somebody who is an able body that doesn't work, I think they're going to say no. But I think, you know, there's a lot of folks that have a very genuine heart, a generous heart, and they would give to the poor, the truly poor and needy. Whenever you talk about education, values to make sure a child gets a good education, I don't think there's a spectrum there. What we do as Republicans, if you will, we have a good product. That's our values. That's a model of limited government that works. That's the value to create jobs and to have an economic system that is stable and can sustain itself. That's not the question. We have a good product. We wrap it in a poor message. I think that the other side, if you will, that supports a nanny state, they have a poor product, but they're able to message it well. What we need to do is identify with folks and bring those in that have similar values. I mean, they're there. So there's a schism in the messaging. There's not a schism in the values. So we've got some work to do.
Representative?
There are some internal batters, absolutely. We've got 95 Republicans in the House, and some aren't as conservative as others. But
You support the decision to find challengers to run against those who are considered less conservative?
I stay out of races other than my own and where I live. And I am openly supporting Donna Campbell. She's done a great job as our senator. I hope she continues to be my senator. She's someone that listens and doesn't make decisions quickly. And that's what we need, is we need more colleagues that, even if they're more moderate or more conservative, we need to be able to sit down and have a discussion with them and convince them of our ideas and why we believe they're best. And there's a great essay that's written out there, is Davy Crockett, and it's a great speech. It's called Not Yours to Give. And I keep a copy on my desktop on my computer, and I read it 2 or 3 times during the session, especially when we have very tough votes, when my heartstrings are getting pulled, when I have emotions being brought into certain issues. And I read that, and I would encourage every single person in here to go out there and read Not Yours to Give. It's a speech by Davy Crockett. It's 100 or so years old. But it is a good reminder for me of what the place of government it is. And it's not my responsibility, or it's not my right to take your money or anybody else's money and give it to somebody else.
Yeah. You have, in this election cycle, the Democrats believe they've got the most competitive 2 candidates at the top of the ticket since Ann Richards was governor back in the early 90s, and Wendy Davis, and now Senator Letitia Vanderpeet. You have any concern about how that election cycle is going to go for your party, Representative?
No.
No worries. This is not materially any different than the past couple of. No Democrat's been elected statewide since 1994. You see no material difference between this cycle and past cycles, given the difference in candidates.
No.
No. Senator, you share representation of the city of San Antonio with Senator Vanderpute. She is your colleague. Senator Davis is your colleague. They're both, articulate champions for their side of things. What's your perspective on their candidacies and the ticket on the Democratic side this time?
They are
He
passionate
didn't
about.
ask you a yes or no question.
I'll get there.
They are passionate about their issues. Senator Davis definitely gained notoriety with her filibuster, but the notoriety is gained by Obama and his support and Hollywood. We're talking Texas, and Texas is conservative, and the majority of Texans were not on the side of her issue. And I absolutely believe that our next governor and lieutenant governor will be Republican.
And you believe Senator Vanderpute is going to be a strong candidate? Again, your colleague now this last session, you believe?
I think she's a good, strong candidate for the Democrats. But once again, majority of Texas is very conservative, and they want to see that model there. And I do believe our governor, our lieutenant governor, our attorney general will be Republican.
I think most Texans would agree with what JFK said, ask not what your country can do for you.
Yeah.
And I think that's a great way to put it. And we're not there trying to find ways for our government to provide for people. We're there to get out of the way, create economic opportunities, reduce some of the hurdles and the barriers that are there, because we're back on education. And I learned this from a teacher a couple of years ago. It's a great analogy, a three-legged stool. You've got the students, you've got the teachers, and you've got the parents. And we've got to make sure that all three of those are actively involved, and we do that by creating a good economic opportunity for those parents so that they can spend more time with their children. Because without that one leg of the stool falls over and you have failure. And without good compensated teachers that are earning a decent living so they can spend time with their families, we lose that leg of the stool. And then, of course, we've got to serve the students and encourage them and make them believe that if they go to school and they finish school, there are certainly going to be better opportunities for them. They'll come to Texas State University, and they'll have even better economic opportunities. The Greater San Marcos Partnership is doing wonderful things here. We're seeing more and more jobs move to this particular area because of those efforts.
Let's bring the audience in, if you don't mind, Senator Representative.
I'm going to bring up a subject no one in here is going to like, but I'm going to bring it up anyway. You keep talking about the cost of insurance, hospitalization, and you talk about the expense to our schools. Mm-hmm. And my common sense tells me, because we're in the state of Texas and we live on the Mexican border, if we could eliminate illegal immigrants who we are educating in our schools and who are using our hospitals and our doctors and taking our Medicaid dollars, we'd have enough money. Where do you stand on that?
Do you believe?
And why aren't we enforcing?
Do you believe, Senator Campbell, that illegal immigration is at the root of our budget problems?
That is part of it, yes. I mean, the root is we have to prioritize our needs. But she is right, and we both have spoke on that. I believe in immigration, but we have a legal way to come here. If that is a problem, needs to be fixed, we need to fix that. But illegal immigration does take a chunk of our dollars, and it's hard to measure exactly how much it takes. But unfortunately, the federal government is falling down on the job. What we've done is put dollars into, it's a drawbridge program where dollars were put in to have actually game cameras around the border so that the state can notify border agents, hey, here's some illegal crossing. We've put more dollars, and we've pretty much done everything we can do as a state, because believe me, we feel it. But we've got more boots on the ground, boats in the water, and planes in the air. I, with Senator Estes, filed a bill to bill the federal government for the dollars that we're spending. Once again, we didn't have anything back on that. But you are right, and it's hard. I mean, and if anybody has a way that the state can fix that, that I don't know about, please
Well,
tell me.
Representative, let me ask. There have been some hardliners on immigration who've suggested that before kids enroll in school, we ask effectively to see their papers. When people show up at the emergency room, we ask if they're citizens. I mean, that is not necessarily an overwhelmingly popular point of view, but it's a view on one side of the conversation. Do you think we ought to be trying to weed out people who may not be here legally from education, healthcare, and the like?
Our federal government has failed in enforcing the laws that are on the books, and I believe we need to reform those laws. There is supply and there's demand, and there's currently a demand for the jobs that are being filled by people that are doing everything possibly they can to provide for their families. And if that means sneaking across the border, that's what they're doing. We need to find a way so they don't have to sneak across the border, so they can come across and be legally documented and be here as active, engaged contributors to society, not having to hide. Because look at what's happened. You have human trafficking is unbelievable. Child trafficking, and these are children and people that are illegal immigrants that have worked with a coyote to get over here and paid that coyote $3,000 to $5,000 and then get caught and sent back, and they've got to pay another coyote to get over here. They're willing to do that much to risk their lives just to be able to provide for their families. And our federal government is failing. If their demand is there and we need these workers here to fill jobs, then that's what we need to do. But we need to get them to be documented here and not be a draw on our system. And there are other countries that say, you're welcome to come here if you can show us you have the financial means, you're never going to be on our social services.
But let me ask the question again, because I hear your answer, but you didn't actually answer the question I asked, which is should we be asking folks who show up at the schoolroom door or at the hospital emergency room for their citizenship papers before we give them education or health care?
No, not before we give them education or health care. If someone is there, that the hospital, and I know the doctor has sworn an oath as a medical doctor that she has this oath that she has to serve people. And that's what hospitals are designed to do. And if someone comes in needing medical attention, we shouldn't turn them away because they're not here legally. But at that point in time, we should help identify them and help them become legal. And if they've got to pay a fine because they came across, and if they broke the law, you have to pay a fine. And that's the way it is. And we are seeing an increasing number of deportations. And so some of the laws are being enforced, but not near at the level that we need to. And it needs to happen at the border. Again, if there's the demand, these people need to be documented that want to come over here, and they should be able to work through their government and our government to come here legally so that they're not hiding in the shadows and they're not being brought over by coyotes and risking their lives to provide for their families.
Dr. Campbell, what Representative Isaac says is true. Deportations are up in the Obama administration over the Bush administration. We seem to actually be enforcing at least the deportation aspect of the law more aggressively than we had in the previous 8 years.
And it could be the numbers are up because there's more coming over. You know, we hear more about.
I think it's on a percent. I think it's on a percentage basis, though.
But I hear what you're saying, and maybe because we're putting more pressure on. I'm not sure why. You know, I hear stories.
You're dissatisfied though with the way that.
Right. I think a better job can be done.
They need to be documented, contributing members of society. That way, the people that are sneaking across the border are ones that mean to do us harm, and we can look for a needle in a stack of needles rather than in a stack, haystack.
Young woman over there, yes.
Hi, my name's Sydney Granger. I'm a third-year PhD student here at Texas State. I'm focusing on developmental education, but I'm also really interested in policy. And it's been my experience that the perspective from academia at how to reach policymakers with the research and the ideas that we as academics and experts in our field are creating, there's sort of a disconnect. So my question is, how do I and other PhD students and experts in our field at this university and other universities, how do we reach you? How can we create the research and the ideas that can help influence policy? What's the best way for us to disseminate our research?
I think for me, and I'm sure for Representative Isaac, we listen. And just like anybody who has a legislative agenda or something they feel is a need, then you bring it to our office and talk about it. I know here at Texas State, we are happy to support, research, and we wanted, anything we can do to help, we try. So for the process in general, for anybody, if there's something that you see needs to be fixed, a law, something that's broken or could be done better or more efficiently, you bring the problem to us, and we look at it. And then it goes to a legislative council, and they look at it. And that's how legislation starts.
Sir.
Dan Boone from Canyon Lake, and I understand, and I'd like to ask Dr. Campbell, as both a politician and as an MD, you seem to be concerned about the cost of health care, and understand that for all of us in this room, we can afford the health care. It's not really a problem for us. But the cost for a person who is indigent, poor, and has a sick child, they wait till they are critical and come then to the emergency room.
Right.
So wouldn't it be better if we provided some sort of mechanism for our less fortunate people to have health care rather than the extra cost of going to the emergency room?
You know this well, Dr. Campbell, as an emergency room doc. It is said to be the most expensive and least efficient delivery of care.
It is.
So what about the idea of somehow trying to get the problem solved before it gets to that point?
And Dan, it's a great question. First of all, there is Medicaid in Texas. There's CHIPS for the poor and the needy. So there is that, but to have it expanded, it's something that the state can't afford. Now, whether there are philanthropic groups that can help, churches that can help, but one thing that people are not accountable for, they show up in the ER, and everybody that shows up in the emergency room is not critically ill. There'll be Medicaid patients that may have been in the doctor's office at 11 and in the ER at 4. Well, did you give the first dose of antibiotic? No. Did you give Tylenol for the fever? No. So that burden is on two people. One, the doctor's office needs to make sure they are doing education. But number two, the people coming to the ER that are not emergency need to have some accountability and go to a doc.
But you don't turn them away. In other words,
No,
I think
not.
a lot of us who are
Do
parents
not.
of young kids, and I know,
We don't.
you know, Representative, you have young kids, for instance,
We
right?
don't. We don't turn them
You
away.
take your kid to the emergency room with a broken arm, or or some kind of injury that is more into the heading of emergency, and the emergency room is full of people who are there really for primary care needs. They don't have any place else to go. Emergency rooms like yours don't turn those people away.
We don't. And like Dan said, I mean, it is more.
So how do you hold them accountable for their being there? They have no other place in their own minds to go.
You know, if I believe health care is a personal responsibility, and if they do not have a job and they meet the poverty level, then there are the programs available in Texas. If they are above the poverty level, then, you know, if they prioritize their own expenses, and there are docs that will, you know, work with you on a sliding scale. There are docs that will allow you to pay out your bill. But with them choosing automatically because it's convenient, it's quick, you get a doctor, going to an ER, we have zero incentives to try to get them to a clinic, which from your point is a cheaper route to go. And people won't, you know, so far as paying for preventative care in children, I mean, we don't have the money in Texas to pay for preventative care. I mean, we really don't. With our budget, we're essentially paying we have got 22% to pay for everything else in Texas. And that means anything from boots on the ground at the border to our, agencies out there, water and roads. So I don't have there's not a panacea for it, but there's got to be some personal accountability.
Representative, isn't this an economic development issue as much as it's a healthcare issue? The workforce piece of this is impacted by the high uninsured population. You'll hear people say, you know, we want to come to Texas, we like the low taxes, we like the predictable regulation, we like the tort reform, but we're concerned that there aren't adequate social and physical infrastructure programs in place to accommodate the people we'd bring with us or the business that we'd have there long term. And one of the things, if you listen to the governor's office, that people in other states are saying is the healthcare system there adequate to accommodate the folks that we're bringing if we move our businesses there? Isn't there that portion of it that we need to be thinking about?
We do, and we need to do what we did this session. And one of the things that motivated me to get into my first race was my frustration with the margins tax. We changed our business taxing structure in the state of Texas from one of profit to one of revenue. And I work in the trucking industry, high revenue industry, very low profit margin.
Right.
And so we saw 10% of the businesses in the state of Texas see a 500% tax increase. 500%, that makes it harder for them to provide for their employees. So they start cutting services. They start looking at certain employees. Guess what? We're not going to offer you insurance anymore. We can't afford it. And I think you're going to continue to see that happen as the cost increase for insurance. So we've got to come in and act as a state and say, you know what, we've got to get rid of the business tax. We did a $1 million deduction and a $1 million exemption for businesses in the state of Texas this year. Every business in the state of Texas, starting in 2014, that earns over $1 million will now have $10,000 more dollars at their disposal to invest in infrastructure, to invest in their employees.
And you think this may kind of indirectly help on the healthcare side because businesses are going to be in a better position financially to possibly provide for?
I hope it does offset some of the increase in their insurance plans that we're hearing about from so many different employers that are saying, gosh, if this really happens, if our insurance is going to go up 30 and 40%, we're going to have to drop insurance, or our employees are going to have to start paying for it if they provide for their employees. But there's really some unique opportunities where you're starting to see more community involvement. I met with some doctors that are opening up offices in schools. So now students, rather than going to the emergency room if they're not feeling well, they can schedule a visit with a doctor in their school. And then it's available to staff, so you reduce the number of sick days for staff, you reduce the number of absent days for students, which increases the funding to the schools, and then families could then use that as their doctor's office if they need to go and get a checkup or if the parents aren't feeling well. And I think you're going to start to see more and more of that over the next few years, more centers like this in the communities. We need to encourage nonprofits. When we lived in Dallas, we belonged to a church that was opening up a clinic on Friday afternoons to serve the poor people of that community, and we need to see that. I think nonprofits and churches do a better job of delivering the services that people need because they do it out of the goodness of their hearts without all the bureaucracy, and I believe we need more of that.
Natalia, do we have time for any more, or are we done?
It is 1 o'clock.
It is 1 o'clock. All right, well, I want to say thank you. We promised to have you out of here at 1 o'clock. Our elected officials, Senator Campbell and Representative Isaac, were very kind to give us the time they did and to be as candid on these issues as they were. Let's please give them a hand and thank them for being here.
Thank you, Evan.
Thank you again to
Thank you.
President Trout, Chancellor McCall, Bob Gratz, everybody at Texas State.